Well, good morning and welcome to City Talk. It's a weekly program that we have on the radio. We do a podcast and we also do a television program. And this is an opportunity for us to communicate great things happening in Waco and talk about some of the issues that are challenging us all. And again, this time, just thankful that we have our mayor again stepping in. This is the fourth time or something like that you've done this. Great opportunity to share great information. And Mayor Kyle Deaver is our guest, along with Natalie Kelinske, who is with the Waco Foundation, and she is the co-chair with our other guest, Hector Sabido, who is our Council District 2 representative. They're the co-chairs of the collaborative program, the fourth one that the mayor. I'm just going to let you tell about this group as well and how you created the concept of this.
So they are the co-chairs of the collaborative working team for strategic communication, which has been really, really important during this time to try to get the word out to all our people in all kinds of different ways about what's going on and what they need to do to stay safe and keep our community safe. And so I'm so glad that we have a communications expert on the council, and then we were able to turn to one of our best communications people in Waco, Natalie Kelinske, at the Waco Foundation. So thank you all both for being willing to serve in this capacity. It's a real blessing to our community.
It's been an honor, sir, and it's been a pleasure working with Natalie, but we have taken our job seriously, and so we are very grateful for the opportunity that was given to us.
Thanks.
Well, I don't give a little better introduction about Natalie. She is the Director of Communications and Donor Services at the Waco Foundation. So you have a communication background too.
Yes, sir. Mm-hmm.
Yeah. And I know you help produce the program we do for the Waco Foundation with Ashley.
Yes.
And you make that happen really good. I'm going to give you more credit than I do Ashley, because she's, as many times as a talent as it may be, you always depend on the people in the background. But the key issues that you all are directed with this collaborative group, as the mayor indicated, was fact-based communication strategy and coordination between government entities. Talk a little bit about that, and because we're trying to include more than the city of Waco, and we ought to also bring in the county. Talk about just that collaborative effort and some of the things that you all do, and then we'll drill into what you all do, because I know I'm the staff liaison on this particular one, and so I get the benefit of watching you all do the things and supporting whatever we can. But talk a little bit about the collaboration and what all you all are doing.
Go ahead, Natalie.
Yeah, so I think one of the things that we talked about really early on was getting the other communities involved. So not just the city of Waco, but all of the surrounding communities. And we've had a lot of success there. We have lots of city managers, city secretaries from other communities who are a part of our group, which is so helpful to get out the information to their constituents. And then we've also been really fortunate. We have representation from several of the local school districts, lots of nonprofits, and different entities like that. So we've really been able to kind of harness a lot of the communications talent that we have locally and push those messages out to groups that we may not really work with every day.
Yeah, that's fantastic, because, for the surrounding communities, obviously, are all interacting all the time in the city of Waco and in their cities, and so with an infectious disease like coronavirus, these things don't stop at city limit signs. Right. And so it's really important, and I appreciate you all reaching out to the other communities. And then, we need to be communicating with everyone, and not everybody uses the same channels of communication. Sure. So I think the fact that you all have reached out to all these other organizations has been really, really effective, and so I appreciate you doing that.
And I think the other part that we, also that we wanted to make sure that we gave out factual information. Obviously, when COVID-19 began and there was still a lot of questions about it, a lot of rumors began to surface as well. And I think one of the important things that Natalie and I really wanted to get out there is information from accurate information from our local officials, from our health officials, and just people that had a better grasp of what COVID-19 and the impact that it would have in our community. And so we've been able to do that, I think, very clearly. And then another important thing was that we did it not only in English, but in Spanish as well. So 95% of the people that are living in our county either speak one or the two language fluently, and that would be beneficial to them. So everyone got the same message, not just a select few. And I think that was one of the things that was very important to us in the beginning as well.
I'm glad you brought that up, because I know one of the things, obviously, on the city council meetings, we tried to up our game as it is there, and we're in addition to American Sign Language, which we're doing.
Sure.
The press conferences, we've been doing a full version, and you've been nice enough to always be a part of it and introduce the fact that we would be doing a full translated version of that, because we want our public to know that.
Absolutely.
One of the other things that I'm really thankful and proud of what this group has done is that made sure that we're giving the same message to everybody. Because you mentioned all the different communication avenues, the Waco Foundation, all the ISDs, all the colleges and universities. Everybody would like to use their platforms to communicate to their folks. But we don't need 15 different messages.
Right.
We need to make a clear and concise one. And I think this collaborative effort has done exactly as the word has indicated. It's collaborating and making sure we have one clear message. And I'm going to step out, and Mayor, you can either support this or not. But we said earlier this is the fourth of the four, and so we'll save the best to last.
That's right. That's right.
And we agree.
Right.
I want to think seriously that the communication effort that we've educated our people has played a major role in our success in McLennan County compared to some of the other counties.
Yeah, I agree. I agree with that. I think we talked about at the last press conference the fact that when we started our shelter-in-place order, our county had one of the highest per capita rates of infection, of positive confirmed tests of any of the populated counties in the state. And by populated, I mean with 200,000 or more. So mid-size and large counties. And now, after being in shelter in place since that date, we have one of the lowest per capita rates, and that's really thanks to the great work that our citizens have done. But they've been able to do that because the messaging has been so good on y'all's part and everybody's part that's been working on that. And Larry, your department has been a huge part of that, and the work that you've done with the press conferences and with the PSAs and all that you've done. I mean, I think that it's no exaggeration to say that all this work has saved lives.
Sure. Yeah.
And that's what we're trying to do, is to get this thing under control so we can reopen our economy and move forward and get back on track. But if we have another big surge, it's going to be a big setback to both our health and our economy. So we've got to be really smart and continue to follow safe practices as we move forward over the next many weeks and probably months.
Well, I appreciate your compliment to our department as it is, but we're only the deliverer of the message. The content and the trust that our citizens have in our local government and the people who are making the decisions, the health district and those kind of, that's critical. But then being able to convey that, and I'm thankful that we do have the ability, and I've said this before we went on the air, if we do not use all this equipment and all the resources that the city has properly, it's worthless.
Sure.
And so it was a blessing for me to be able to say, yes, let's step forward. And we have the resources to develop the COVIDWaco.com website. We did that early on, and I think that has been something that collaboratively we've all agreed. Let's focus our attention. Now, everybody work on content. We'll do the production work.
Yeah.
Right. And so we have that talent.
Well, and that COVIDWaco.com website is just so rich with content.
Exactly.
And, we felt like when we were at the beginning, we were a little bit behind on our data and our content and our website. I look at our website now and compare it to counties around the state, cities around the state, and I just feel like we're doing a really good job of keeping people informed and advised about where we are with the disease, what resources are available for both people and businesses, and it's just it just continues to be the best place I can find to find the best information.
We very quickly jumped on and bought the WacoCovid.com.org and McLennan County COVID.com and .org.
Right.
Very inexpensive venture, but that tied those up and it made a simple website for then you all and other people in the community to collaborate, to create, critique, change, edit, and those things that are so critical in a website or any communication effort, because we can do the work, but it takes the collaborative effort of input of proper information, accurate, and what your thing says here, fact-based, information.
Yeah, and it takes a lot of coordination with the health district and the EOC, bringing together the current information on, we're still trying to get the current information on tests that have been given each day. And it's just more complicated than people understand to get that accurate information and get it timely. But we're very close to adding that component as well.
And if I may also brag on the city staff that we have, it's just the website, going back to covidwaco.com and McLennan-County-COVID.com. It's just another component of council's importance of equity and inclusion. So on that website, you will also have English and Spanish translation as well. You will also have the breakdown by demographics and ethnicities. Obviously, we've seen in other parts of our country where minority groups or people of color have been impacted larger by COVID-19, and we're not seeing that in our county, and you can reflect that in the numbers that are shown on the website every day. And so I just really want to give a big kudos to the city staff that has just worked around the clock, honestly, to put that together, keep it updated, almost by the hour, and just, going far above and beyond that was even asked of them. And so I don't say this lightly, but I think we really have the best city staff that anybody could ask for.
Yeah, I agree with that. And we have really focused on the race and ethnicity aspect of it and trying to be sure we have an equitable response to this disease. It's challenging, because there are historical aspects of healthcare that have not been equitable, and everybody that I know in the city government and also in the healthcare industry recognizes that here, and so that's the first step.
Sure.
And now we're trying really hard to not let that happen in this case, and so. I agree. I think we need to give staff compliments for that, and also all our healthcare professionals that are working hard to try to avoid that outcome as well.
I want to focus back on the collaborative group that you all have, because again, we talked about, and I appreciate all the kudos that you've passed on, but again, it's a joy to share and use what we have, the talents that we've been given or whatever, to better communicate. But the message has to be out there.
Right.
And you all have done a great job of helping collaborate that effort. Talk to us now, because I know, and I'm going to speak because I'm a part of this group, but I want y'all to tell our audience about it. The fact that you all meet twice a week virtually, you all put out news. Talk about the things that the collaboration is doing.
Yeah. So just like you said, right now we're meeting twice a week with a group that we call our key partners. And that really includes all of the surrounding communities, all of our ISDs, higher education, nonprofits. And we use that time to share ideas and share information so that we all know what's going on. And then we take time to kind of refine some of those ideas and prioritize those messages. And we put out a twice weekly newsletter that you can sign up for on the COVID Waco website. And that newsletter really focuses on 3 different areas, the other 3 work groups. So we have individual and business recovery, health, and then education and social services. So we try to refine a message for every newsletter in one of those areas. And the newsletter, of course, goes out to all of our key partners and people in the community. But I think what really we use their contacts to leverage that, and they post it on their website, they post it on their social media, and that's really where we're getting a lot of the viewership. So just like you said, it's very much a collaborative effort, and that's kind of the process that we're going through right now. And then Hector's taking the lead on some PSAs and some other things that we're doing.
And we've been very fortunate that our community partners, our key partners, have been very willing and able to want to do PSA. So we have, of course, Mayor Deaver that has done some in the past. We have people from other ISDs. And then on top of that, the media has been very supportive in airing those PSAs. So we have the local TV stations, we have the local radio stations. And so I'm just amazed to see how the county has come together just to really work on this. And everyone's just saying, what's my part to do in this? And so it has made it very easy to get the message out.
Back to your e-newsletter, that is really very effective, but it also is in Spanish as well.
Mm-hmm. It is.
The full version, so you just roll on down and there's the information all right there. And the same way with a lot of the PSAs, we have multilingual versions of that available, and those are being posted not only on our city channel, for example, but all of the other places that we're doing that. So, a lot of collaborative effort If you just joined us, we're visiting with our mayor, Kyle Deaver, again for the fourth or fifth time now. But also we have our councilman representative for District 2, Hector Sabido, who is the co-chair along with Natalie Kelinske, who is the communication director and donor services with the Waco Foundation. So two great communicators and doing a great job of pulling the information about this COVID-19 around. One of the things I happened to mention to my granddaughter the other day, I said, do you know why it's called COVID-19? A lot of people don't know about that.
Right.
So we're going to put that out for sure that it's COVID-19 because it was diagnosed in 2019. So hopefully we won't have, but if it might be something if a new virus is discovered 2020. It might be a COVID-20. So just a minor little fact that I just thought about. I said, I'm going to share that. You're going to say, you ever thought about that?
There you go. It's not the 19th edition, right?
That's right. Exactly right. We've got a lot of things to talk about. I want you all to make sure you've talked about now your collaborative as well, though. And we'll make sure we've given the proper credit to, I know you've got Baylor, TSTC, and MCC involved. You mentioned the ISDs, the various city managers and the cities involved into there. That's the main part of the thing, to make sure everybody is represented.
Sure. And even at the county level, we have Commissioner Miller that has joined us on a weekly basis. And so it's just people that are taking time out of their busy schedule to really get on this call twice a week, which we meet about once the conversation gets going. We're on there for about an hour, and a lot of great ideas are sparking. And so I'm very grateful that the people that keep coming back week after week after week to just want to be a part of the solution and just be key players in attacking this COVID-19 situation.
Yeah, it's, the collaboration in our community is just remarkable, and that's one of the things. I mean, we wanted to make the point early on. We know all these groups are doing this work anyway, but when we all do it together, it just is so much better.
Right, absolutely.
The product is so much better, and it's more consistent, and it reaches more folks. And so, that collaboration, the spirit of collaboration, has been built in this community over the last many years. And I think that is one of the things too that has helped us do really well in this pandemic.
Yeah. Talking about the collaborative messaging now, in the past, over the last 3 or 4 weeks or more, since the whole COVID-19 started unrolling, we started talking about when you did, Mayor, the March 23rd, the shelter-in-place order. We were talking about stay at home, save lives, those messages. Now that the governor has come out with his message on the 27th of April, allowing for businesses, restaurants, libraries, things like that to partially open as it may be, but 25% capacity.
Right.
I think the group is looking at changing some of the messaging. The messages are still the same to a great extent, but maybe the way we're saying things. And I use an example here, coming from you. Instead of social distancing, we're going to do physical distancing. It's the same thing.
Yeah, our orders still say social distancing because that's the formal language that we've used, but we continue to see increased mental health and behavioral health issues that are arising in part because of people being isolated. And so we really want to encourage people to connect electronically or go for a walk with somebody and keep 6 feet apart. You can still see your friends and go exercise. But the reality is that the governor's order has not made it so that we should be having huge gatherings.
Right.
There is under his order, a social gathering of any size is against his. It would be in violation of his order. But at the same time, he tells you that you can get out and exercise, and that's because we need that for our mental and physical health. And so you're trying to walk this line of trying to be as safe as we can be, while also maintaining your mental sanity. And now we're reopening these businesses in small part. But we need people to continue to be really careful and continue to observe the distancing guidelines and wearing a face covering when you're out, especially when you go into a store that is crowded. You go into the convenience store or the grocery store or a big box store like Home Depot or Lowe's. All of those businesses are working hard to keep you safe, and they're limiting the number of people that can come in. But you still got to do your part while you're in there to keep each other safe. And that face covering, which doesn't have to be a mask. I mean, a mask is best, but masks are kind of hard to come by right now. And so I use a fishing buff or a net gator when I go into a store. And it's really not to protect you so much as it is to protect the others around you, because we know that COVID-19 is spread by a lot of people who don't have symptoms at all. So they don't know that they're sick. And you don't know that you don't know whether you're sick or not. I don't know whether I might be sick. And so when I go into a store, I need to cover my face, my nose, and my mouth so that there's not a chance of me infecting others. So you're right. We were talking about masks. Now we're talking about face coverings. We were talking about social distancing. Now we're talking about keep your physical distance. And there are probably others.
And I think the message that we want to get out is that, even though the shelter in place maybe is coming to an end, but we still want to make sure that people are hopefully only leaving their home for essential duties. So if you have to go to the grocery store, for those essential workers that are still having to go to work, there's still ways that you can support your local restaurants and local retailers, but still, going back to your home, I mean, businesses are opening up and the economy is opening up, and I think that's a great thing. But also we have to make sure that we do it in a very safe manner, and to try to do everything we can on our end to stop the spread. And it starts by controlling what we do as individuals.
Absolutely. And I think one of the things that I really picked out of the very first thing when the governor started making his order on the 27th was the fact that he is allowing businesses. He was not saying they will open.
Right.
This is giving the choice. And that's touched on a few things, because there's a few people, businesses, and maybe churches and things that are making the decision to protect their employees and their people. Talk a little bit about that, because I know we as a city, we're choosing not to open the libraries, even though libraries could be open. Explain the difference between.
Right. Well, so one of the considerations for a lot of businesses is whether it makes sense for them economically to open at 25% of capacity, or 25% of occupancy. In some cases it doesn't make sense, and in our case with the library, that's a good example. We didn't feel like at a 25% occupancy we could really be effective in serving our patrons, our citizens. And we've been doing so well with the curbside book delivery that seems to be a very effective way to continue to serve that population and provide that service. We really don't want people coming inside and having their hands all over books and passing them back. This is a safer way. We can wipe down the books, and we can be more careful with that. But that is a good example. We have also decided not to open the zoo yet. That probably will happen in the next phase. But there are a number of our assets, our facilities that we've decided not to open yet.
Well, I think it's very clear.
And I should say, Larry, churches. There are a lot of our churches that are choosing not to open just yet. Right. They recognize the risk that could have a huge impact on the spread of the disease, and so they're waiting a little while longer to see that numbers don't spike up with this first round of openings. So,
well, I think that the key point that you just said, I think, is very important for everybody to know now, is the fact that this is by no means over, and we are at a new stage. And I think the governor is wanting to do what he can primarily from a financial standpoint, recognizing the challenges so many people are facing, unemployment and things like that, and getting the economy moving a little bit. But the main thing we need to focus on is the fact that we still need to stay the course, and shelter in place still is the answer. And as you said before, and we were talking about before we went on the air, if we don't do a good job during this 25% occupancy, we're not going to be able to go to phase 2. Talk a little bit about that.
Well, that's right. I mean, the governor opened up this first window. And now he will wait for 14 days, because it takes that long to be able to see the data, to see the testing data, and see whether cases are really increasing too rapidly for us to be able to treat them. And so if we don't do a good job as a state, he will have to wait before he can open up the next phase. He might even have to take it back to shelter in place, and nobody wants that. So we've just got to continue with caution. And I know everybody's tired of hearing that. I mean, I'm tired of saying it, and it's not going away anytime soon. That's the reality of it. Is we're going to be having to be careful until there is a vaccine, and that's months, if not more than a year away. So it's going to be a while, and we've got to get used to this new kind of get how we're going to act for the next.
Mayor, there's a new term that's going around. It's called the new norm.
Yeah.
And so we can't expect things to go back to the way they were 8-12 weeks ago. And so we have to get used to, I think, maybe not greeting each other with the handshake right now, or still not being in large public areas, or going out in public with face coverings. And that's just our new normal for now. And I think that if all of us learn to accept that and adapt to it, this is just another way of combating the disease.
Yeah, I mean, I will say the first time I went into the store with a face covering, it felt really weird.
Yeah.
It's awkward. That's not what we're used to. But it gets easier, and you really are taking care of your fellow Central Texans by doing it.
And I think, and we've said it on this program several times, the fact that our community as a whole has responded so well,
Yes.
and so positively, in such a friendly manner. I think that's the success of it. And to me, that's the real heart of Waco. Sure. The heart of Texas as it is, we've got a caring, giving, and we've realized the fact that the only way to beat this bad guy is to protect ourselves. There's no other way.
Yeah, and work together to do it.
Right.
Yeah. And Natalie, the Waco Foundation is such a big part
Yes.
of all of this that's going on. Can you talk a little bit about what's happening there at the Waco Foundation in terms of, I know they just stood up an emergency fund that people can donate to.
So yes, there will be an emergency fund that folks can give to that will support individuals and families. The funds will be distributed to nonprofits who can then distribute them directly to individuals and families who need extra assistance right now. We're also working with a lot of our community support organizations, the other foundations, Prosper Waco, United Way, to support our nonprofits. So our nonprofits are being asked to do more with less in a lot of cases right now. And so we are working very hard to increase their capacity so that they can care for the folks in Central Texas. But again, it's very much a community effort. It's not just one foundation or one entity. We're all working very closely together, hand in hand. And the messaging comes into play there too. So we're really trying to, for all of the community support organizations, trying to put the same message with all of our nonprofits. So there's no confusion. And so we can just be very clear about next steps and what we're doing.
That's great.
Well, there's been a couple of articles, letters to the editor in the paper, whatever else, that maybe it made me think about it. I said, because a lot of the stimulus checks that were being issued were going to people who have not lost their job, who are still employed, who are getting the same income. And I think it would be very appropriate to say, hey, consider giving that to the Waco Foundation to then distribute to the people who are really in need, that are hurting, because it doesn't necessarily need to be a stimulus to go out and spend more money, which does help the economy.
Sure. But
there are people locally who are really hurting. And so it's a chance to give. And I'm not saying everybody needs to do it, but it's just an opportunity to think, oh, okay, this money I'm receiving, I don't really have to have. I'm going to give it to somebody that does. And that's just it. We've got about a minute left, and I want to make sure, Mayor, we've gotten everything we want to make sure from the governor's order. I know the press conference, you covered a lot of points and things. This is just another opportunity to make sure we get a clear message through on anything you want to push.
Yeah, I just think I want to thank all the people in Central Texas who have done a really good job to get us to the point that we are. We are in as good a shape as a county and a city as we could be entering this phase of reopening. But we've got to continue to be careful as we go forward. I think we need to continue to thank and pray for our first responders and our healthcare workers who are continue to be on the front line. And this thing is not going away just because we're starting to open up some businesses. In fact, in some ways, they're now more worried than ever that we're going to have a big increase. And so we've got to do our part to keep that big spike from coming. And I believe and I know that our Waco and McLennan County residents will do that.
Absolutely. I want to thank our Mayor, Kyle Deaver, our District 2 Representative, Hector Sabido, and Natalie Kelinske, who are co-chair together the collaborative committee that I'm privileged to be a part of, the strategic communication part that the Mayor created, for being with us today and doing a great job of making that message clear and straight. And thanks for being with us this morning.
Thank you, Larry.
We hope you'll join us again next week for more information about the City of Waco on City Talk.
This program is produced by the Municipal Information Department of the City of Waco and is provided as a public service by this station.